Hello, my name is Aubriana McClendon, and for my disease, I chose impetigo. What is impetigo? Impetigo is a common bacterial skin infection and is highly contagious. While commonly superficial, ecthyma is impetigo affecting deeper parts of the skin. Impetigo is caused by Streptococcus pyogenes and Staphylococcus aureus, or both. The skin's barrier is disrupted and colonized by the harmful bacteria. This disease typically affects children ages 2 to 5 years old but can occur at any age. Okay, now we have bullous versus non-bullous impetigos. Bullous is mainly caused by Staphylococcus aureus, and it makes up 30% of the cases, and it can be found on the face, trunk, buttocks, and perineal region. For non-bullous is caused by both bacteria, and it makes up 70% of cases, and it's mostly found on the face, but it can affect any part of the body, and it affects the skin through insect bites, eczema, or any other skin lesions caused by either scratching yourself or other diseases. Okay, they both spread through autoinoculation. For bullet, for regular bullets, it's spread distally, and for non-bullets, it's spread with satellite lesions. And this just means that the infection can spread from one body site to another. Impetigo is characterized by pustules and honey-colored erosions. It usually starts as maculopapular lesions that become thin-walled vesicles that rapidly rupture. And when these lesions rupture, that is where that crust that we normally see with this disease, like when you see this disease, you picture the crust on the skin. That is where that comes from. This is an example. His lesions burst and now they're starting to form a crust. In children, the symptoms are red bumps, itchy swollen red areas, fluid-filled sores, draining fluid sores, crusted over sores, and swollen lymph glands. And in adults also have the same symptoms, but it is accompanied by an itching and burning sensation on the areas. And here are a few pictures of examples. Okay, now we will be taking a closer look at Streptococcus pyogenes. This is a gram-positive bacteria that is spirally or cockeye shaped that forms chains, and it can be both invasive and non-invasive. For the disease impetigo, it is non-invasive. This bacteria exhibits beta hemolysis when grown on blood agar plates, and impetigo Streptococcus pyogenes has the ability to invade through breaks in the skin, and it can lead to secondary infections of existing skin lesions. And these skin breaks are typically either if you have a pre-existing condition such as eczema or trauma to the skin such as scratching yourself or cuts, or insect bites. This is how this bacteria can take over and infect the skin. For the Staphylococcus aureus bacteria, it is also gram-positive, spirally shaped, and it forms clusters, singles, in pairs, or in short chains. In most cases of impetigo, it appears in the bullous form. It produces an exfoliative toxin that disrupts the skin's barrier, and this toxin has both type A and B. Desmoglein 1 is the protein that is crucial for cell adhesion in the epidermis. This protein is targeted, and the separation of cells form blistering and the typical honey-colored crust that is associated with this disease. And to the side, this is a picture of the bacteria, and this is a gram-positive stain. Now we're going to be going into the risk and the transmission of impetigo. Okay, who are at risk? Mainly children ages 2 to 5 are the most common group associated with this disease, but this disease can happen to anyone no matter their age. This is a contact transmission disease, meaning if you come into direct to sorry, if you come into contact directly with someone who has this disease, your chances of getting disease are very high, especially if you have any type of lesion or cuts on your skin. Like as I said before, having any type of lesion or trauma to your skin increases your risk of impetigo. Okay, and your lack of hygiene also includes the risk. You should always be washing your hands, and if a person comes into contact with it and they do not wash their hands and they touch their face, touch any other parts of their body, they are increasing their risk of getting this disease. And for the environment, this disease can pop up in all environments, but it's most common during the warm, humid areas or during the summertime, and it's also common in high populated areas such as schools or daycares. Now let's get into the lesion progression. This disease starts as pustules. Well, before that, it's papules, then it goes to pustules, and it's depending on the type of impetigo the infected person has. It can go to bolus type. As we see here in the first picture, we have a fluid-filled bolus, and these can pop, and when they pop, they form a crust, as we see the typical characteristic with this disease, the crust on the skin, and then we have this one. And then we can also go to the non-bullous forms, which is most typically seen here. It's caused by both of the bacteria. Once again, you just have all of the lesions on the face. They pop, they're red, swollen, and then they eventually start to crust over. Okay. For diagnosing, Diagnosis for impetigo is always clinical. A doctor will not always perform a culture, but depending on how the symptoms are or how the patient is doing, they will culture and send it to a lab, like do a lab culture. But usually they just go straight away to the antibiotic treatment, which is oral or topical depending on the severity of the impetigo. Oral is used for the most severe, while topical is used for mild cases. And it's always recommended to clean and bandage any draining or leaking lesions or, uh, yeah, lesions. Okay. And the antibiotic treatment should treat both oris and pyaginus. Okay. Prevention. To prevent the spread of impetigo, after starting your antibiotic treatment, is recommended to basically quarantine for 24 hours. If you have a kid who's infected, don't send them to school because they have the high risk of infecting other kids. And you must cover any draining lesions or sores with bandages. You must wash your hands and practice good hygiene. And do not share towels or clothes with anyone. And for kids, this is important to try to minimize the damage they can do to their skin. One way is to cut their fingernails so they won't scratch themselves and create new wounds for the bacteria to move to. And these are my references. Sorry for any stutters. I hope you enjoyed the presentation. Thank you.